Next on Health Tech Today, we go to Rio de Janeiro and see an amazing example of how electronic health records in the cloud are changing public health.
Now, we help Rio de Janeiro to have 1 million people with registered in the family doctor program.
In Rio de Janeiro, primary care is a critical issue in public health. As much as 75% of the population doesn't have a general practitioner and relies on emergency rooms for healthcare services. A Portuguese company working in Brazil, Health Innovation Systems, has created a cloud-based integrated electronic health record called Vitacare. Because Vitacare is a patient-centric health record, the information follows the patient so that everything, prescription, doctor's report, or insurance information, it all goes into one record. This is key in helping the hospitals and government agencies keep track of chronic conditions and take a more proactive approach to prevention. Here to talk with us about public health in Brazil is the CEO from Health Innovation Systems, Nuno Dias. Nuno, thanks so much for joining us today, all the way from Rio, Brazil.
Hi, how are you doing, Bill?
I'm doing very well, thank you. So you have what I think is a very exciting cloud-based patient record solution called Vitacare. Nuno, as you well know, there are hundreds of EMR and HIS solutions on the market. What do you think really differentiates your solution from all the others?
We started our project in Brazil last January. So we already have 1 million citizens registered in the applications. We already have 4,000 to 5,000 professionals using the applications, and all of this in 6 months' time. So at the same time, it's how fast we are in adapting the solution to the local markets. Our understanding is one of the problems in the HIS solutions or health solutions, it's how they're not so flexible, so it takes too long and it becomes too expensive to adapt the solutions to the local needs and the unit needs. So this is the point. I understand that we are being a little bit different than our competition.
It sounds like the solution is successful not only because of its lower cost, but because it's intuitive and easier to use. Tell me about that. I mean, what are clinicians who are using it saying? Is it more intuitive?
Yes. Well, as you know, you are using all Microsoft tools like CUI, Silverlight, and so on. So what we have made is we almost have one electronic health record for each professional. So using that technology, the professionals now can choose the way they organize their own screen. So it helps a lot because they feel that they are not like a slave of the system. So and they can be proactive, organizing the system as to the way they work. Yeah.
So it sounds like it's also more flexible than some of the other solutions on the market.
Yes, this is what the professionals are telling us. Yes.
I understand that there are applications of Vitacare in population health and for the health minister and others to get a better picture of public health. Tell me a little bit more about that.
Every day, the government has information regarding all the population they are managing in terms of public health. As you know, in Brazil, for example, you have some tropical diseases, yeah, and these tropical diseases it comes in different times, yeah, like for example dengue. They know very fast if something is happened in a specific neighborhood, yeah. So they can act immediately.
And it sounds like the government is getting a great value using your solution to better understand public health and disease outbreak scenarios. Are there other ways that your solution is improving public health?
We have to work with governments in, well, helping them to use better the money they have. Yeah, it's not just putting more money, it's using better the money they have. Because sometimes, for example, if they can save 50% of the money in medicines, maybe they can put this 50% on prevention or things like that. So that's the point.
In terms of Vitacare and the work that you're doing in Brazil, what do you feel most proud about?
Now, we help Rio de Janeiro to have 1 million people with registered in the family doctor program. Yeah, so this is 1 million people, not just 10 or 100. It's 1 million. So it's 6 months ago or 9 months ago that people were not registered in the public health primary care. So we are helping people in Rio de Janeiro, hopefully in other states in Brazil to have a family doctor.
Thank you, Nuno Dias, for joining us today and telling us about these significant developments in public health worldwide.
Well, thank you for inviting me to do this interview.
It's our pleasure. Thanks for taking time to join us on Health Tech Today. On behalf of Microsoft Worldwide Health, our staff and sponsors, I'd like to thank you for joining us. We always enjoy hearing your feedback. We'll see you next time for another episode of Health Tech Today.
For more thoughts, comments, news and reflections on healthcare IT, join Dr. Bill Crounse on Health Blog.